Welcome to NeuroSeduction, putting science back into neuroscience, with your host, me, Lalith Famlapoli. Today, we have with us Dr. Jose Smith. Dr. Smith is a wound care attending physician at Pinnacle Wound Management. He also serves as an urgent care physician at Well Family Care, a telemedicine center.
Hello, how are you guys doing?
Hello, Dr. Smith. Since you've traveled a long and arduous path of becoming a doctor, what inspired you to go into medicine?
To be honest with you, I kind of always wanted to go into medicine, but I took a little bit of a path less traveled. I was in pre-med in college. In my last year of college, 9/11 happened. And so I decided that I wanted to go serve when I graduated. My dad was actually at the Pentagon the day it got hit. My dad was a superintendent for a construction company, and the area that got hit in the Pentagon was the area that was under renovations. So a lot of the people that were killed and injured at the Pentagon were guys that worked for my dad. So I kind of put medicine on the back burner. Went to the military, went to the Navy, did 9 years, got out, went to medical school because that was always my ultimate goal. So I decided that I wanted to try to achieve that ultimate goal and put my military career behind me and applied to medical school, got in.
Becoming a physician requires many years of schooling and dedication to keep continuing. What would you say the process is like to become a physician?
Well, it's like you said yourself, it's very long. However, it just takes determination. You just gotta. There is light at the end of the tunnel. I want people to know that when they're starting on this. I mean, people are starting thinking about applying to medical school when they're in high school. So from the time you're in high school, then finish school, go to college, get your degree, then apply to med school, take your MCATs. It's a long time. This is something that takes dedication. You can't just all of a sudden be like, hey, I'm going to do this. This takes years of preparation and years of passion, to be quite honest with you. If you're not passionate about it, you'll never make it.
What would you say are like 3 skills you would probably need to be a physician?
Critical thinking, organization, and passion, determination. Those 2 things, dedication, however you want to describe that. But yeah, you definitely need to be able to commit to the process, because the process is, like you said, long and arduous.
Yeah. As you are a wound care specialist, how did the specialization come into the picture, and how does it impact your care for patients?
So I'm a wound care specialist. I started off with the residency for general surgery, and then I decided to go into wound care because I liked it. It's procedure based, but it also gives me a very good work-life balance. It's not like general surgery where you're on call every third night and you're away from home a lot. So I went into wound care to kind of have that nice work-life balance and still maintain a procedure-based, surgical-based practice.
And for a little bit of clarification, what does wound care, what do you see in wound care?
I see a lot of stuff. I see diabetic ulcers, pressure ulcers, arterial issues. I can do amputations, stuff like that, of digits and of feet, below the knee, above the knee, amputation, stuff like that. I see a lot of older geriatric care, a lot of older people that are in nursing homes and stuff like that, with pressure ulcers and wounds and stuff like that. So I mean, those are the main things. But I still do operate every once in a while. Unfortunately, when I'm doing the operations, it's not necessarily a good thing. I'm not doing it to save a life or something like that. I'm doing it to remove a a toe or a foot or something along those lines.
So COVID, the biggest elephant in the room, has affected many different people and has influenced the field of medicine. So
Yeah.
how would you say you changed? Or how do you say your practice changed due to the pandemic?
Well, when the pandemic first started, all elective surgeries were put on a back burner, and I wasn't really seeing patients a lot. Places were in lockdown, and you only came in if you needed to. So at that time, I kind of shifted gears with my practice and went to work in an urgent care. Kind of left wound care, kind of left, not really left it, but pushed it over to the side because I wasn't able to be able to go to the places and do the procedures that I would normally do. So, and I wanted to help, being a wound care specialist physician, yes, I specialize in wound care, but I'm still a physician. So I kind of shifted gears and went to work in the urgent care setting as both the, in open 24/7, type of facility for urgent care, but also doing telemedicine for those who were, hesitant to want to come to the facility. So I did both, and kind of, it really got me back in more to the medicine portion of practicing medicine. Whereas before, I was so hyper focused on wound care and specialization in my field that I didn't really keep up, not necessarily keep up, but it just helped me sharpen my skills and hone my skills as a physician, not just as a wound care surgeon.
And with the pandemic, there's been many changes, especially in medicine. And medicine is consistently changing to incorporate better methods of helping people.
Mhm.
So, what would you want the field of medicine to change in the next 10 years?
Well, I in a general sense, I think the main thing that we're going to start to see a lot of is specialized, specific to the patient treatment, with genetic medicine and the incorporation of one's own individual genomic makeup. We're going to see a lot more tailored, very patient specific medicine, whether it's because of treating their hypertension. We can do a genetic profile and see, is an angiotensin receptor blocker medication going to work on this patient because of their renin profile, and we don't have to really do that guess and check work anymore, where it's like, oh, we'll try this and then we'll add one, and if that doesn't work, we'll switch it up. We can run those genetic tests and know, hey, this is the medication we're going to need. Same thing with, like, just cancer or diabetes or something like that. We can start to detect those things based off of genetics before they become a problem and be proactive instead of reactive. I think proactive medicine and knowing, what a patient is susceptible to through those testings are going to be really important as medicine progresses over the next 10 years.
So, this YouTube channel kind of addresses the lack of sometimes less experimental or maybe less scientific medicine. And how would you say wound care kind of prevents from falling into this pitfall of pseudoscience?
Okay, well, the thing is, wound care has really become big over the last 10 to 15 years or so. It's an interdisciplinary specialty. We incorporate surgeons, podiatrists, dermatologists, and we also have wound care nurses, walk nurses, wound ostomy care nurses, stuff like that. Like I said, it's very multidisciplinary, but for the first 50 years of wound care, it hasn't really changed. And it's only, like I said, here in the last 10 to 15 years that we've really gotten into the science of how wounds heal and what can cause them to stall or regress and stuff like that. So there's a lot of R&D going on in the wound care specialty right now. There's lots and lots of, like, every year there's probably anywhere from 500 to 2,000 new wound care products that are getting FDA approval to be used. And back before that, it was like, before 2005, there was maybe 5 things you could do. And then so the rapid expansion and growth of the research and development in the wound care field has been very, very high level stuff. And I think that it's gotten to a point to where we're kind of saturating the market, but it's all being done and backed up and proven. It's not, people are in a, try to publish, get the newest, latest and greatest stuff out there, but we're also getting, real good research done on this stuff. So, keeping the science in it is the important part. Whereas before, you could just be selling snake oil or something like that. But nowadays, like, everyone wants to see the evidence-based medicine on these new products that come out. So there's a lot of research being done that wasn't being done before.
And finally, there's many students who are interested in going to medicine. What is some advice you can give to them?
I mean, my number one advice to anyone in any field would be, be passionate about it. You have to love it. You have to live it and breathe it. They say if you do something you love, you never truly work a day in your life. And I tend to agree with that situation, or with that statement. Medicine is not for the faint of heart. If you're wishy-washy or you don't know, then I would recommend you don't go into it, because it is very arduous. Takes a lot of hard work and dedication and discipline. And I would definitely recommend that before someone decide to do or make their career at medicine, they do their research, they do their due diligence and look into it and see, just how much effort and time and everything else it takes into it. I would encourage anyone who really wants to go into medicine to go. It's a very rewarding career. I get to help people. I get to see the smiles on their faces, specifically from a wound care side, when, because you're following the whole time from the initial wound consult until the wound is healed. I get to see the people like every week up until that point. And it's very rewarding personally to know that I'm making a difference in that person's life. So I think that anyone who wants to do that, it's highly rewarding. But like I said, it takes a lot of discipline, dedication, and passion for the field.
That was probably one of the most interesting interviews I've had. You really went into the depth of what wound care really is and what it stands for. So I'd like to thank you, Dr. Smith, for generously giving me time today.
All right, thank you, sir. I appreciate it. Thanks for having me on.
Thank you.